In the last few weeks, we've seen an enormous attention towards questions of mental health in humanitarian and development contexts. I think it's a big deal. It's something that we started looking at very actively, getting close to a decade ago at this point, but have really become more and more sophisticated in the way that we look at it. We start with making sure that people are getting access to the kind of staff care resources that they need in terms of counseling and things like that. For our expatriate staff, there is a number of things that are sort of built into assignments in conflict areas in terms of short-term rest and the ability to get out of the environment and things like that that are important to rest and recharge and get your mental health back. And mental health is one aspect of it, but there's many. People's physical health actually deteriorates when you're under this kind of stress for an extended period. Yeah. But we've also looked beyond the sort of short-term rest and the counseling at questions of how long should people really be working in an active conflict environment? At what point should they come out of that environment for an extended period of time or work in a more normal environment that lets them recharge their batteries, get their health back to where it ought to be?
Over the years, it's not been considered real medicine, if you will. So I think now that's something that people understand, that the psychosocial impacts can really have physical impacts as well. So I think IOM and other organizations are working hard to take that to the next step, to be able, we've recently brought in a stress counselor as well as part of the UN country team to be able to discuss some of those stressful issues that people have been going through and looking at opportunities and discussing that, particularly those who have been exposed to more difficult situations. Over time, it's consistently day in, day out, so it's the work-life balance is critical, and it is true. I think a lot of times you have so much going on, so much to balance all over at once. It's important to keep that in the mind, and also just take those breaks for yourself, because that gives you the rejuvenation to be able to go on and to even be more effective you.
So often when you're working in a conflict setting, individuals have experienced the conflict themselves. They've been directly impacted. We're operating a program in Syria now, and even for the folks who've come over the border and escaped from Syria, many experience the violence firsthand. Many have family members who are still in Syria and face the day-to-day questions about whether or not their family members are safe. And so if you add that stress onto a fast-paced, high-stakes development project, it can really be detrimental to staff. So we find it essential to bring in counseling services, staff care services, and support, particularly for our local staff in these contexts, but also for expatriates, because the stress of working in these environments where it feels like every minute counts can take a large toll over time on the mental health of really everyone working on these conflict projects.